If you're watching this video, then I'm guessing that you've just found out you are pregnant and you're thinking, what happens next? So the first thing is that you'll have a consultation with your midwife called a booking appointment, and during this appointment you'll go through all your medical and obstetric history, and you will also be offered all your ultrasound scans and any screening tests offered to you during your pregnancy. And one of these ultrasound scans is your dating scan, also known to most of you as the 12-week scan, and this can happen any time between 10 and 14 weeks of pregnancy. This is a really exciting time to be able to see your baby grow, especially to see this on the scan, and you may be able to find out the baby's gender at this scan too, if this is something that you wish for, but you'll need to ask their healthcare professional who's doing your scan if you can find this out. And this scan will be able to tell you how many weeks pregnant you are, give you an estimated due date for the delivery of your baby, whether you're pregnant with more than one baby, and also to see how your baby is developing. With your scan, you will also be offered screening for Downs, Edwards and Patau syndrome. And you can either make the choice to have no screening, have screening for all of them, or just have screening for Down syndrome, or just have screening for Edwards and Patau syndrome. But this will be your decision to make. So to briefly explain to you what these conditions are, Down syndrome is when your baby is born with an extra chromosome called the 21 chromosome. And this is associated with learning disability, and also people with Down syndrome are more common to have health conditions. However, saying this condition isn't life-limiting, and they can be healthy and active and lead a fairly independent life. Unfortunately, babies born with Edwards or Patau syndrome have a lot more serious problems and are associated with conditions that can affect their brain. And these babies usually pass away before or after delivery. However, some can survive to adulthood, but this is very rare. If you do decide to have screening for all these three conditions, this is called a combined test, and it is performed using a blood test and an ultrasound scan. During this ultrasound scan, the sonographer will measure the fluid at the back of the baby's neck, and this is called a nuchal translucency test. And this won't affect you or your baby in any way, as these screening tests are non-invasive. Every baby has fluid at the back of their neck, but babies with these three conditions usually have more fluid at the back of their neck, and this is why we measure the fluid. If for any reason they weren't able to do the nuchal translucency test because your baby was lying in a difficult position, or if for any other reason, you will then be offered a quadruple test which is performed after 14 weeks of pregnancy, and this involves a blood test which only screens for Down syndrome. This is your choice to have this or not. You would also be offered this if your first scan is after 14 weeks of pregnancy, but it's important to know that this isn't as accurate as the combined test. The screening test will give you an estimated chance of your baby having a condition by using the blood test, the scan, and also your age, as some of these conditions are more common in older mothers. But this screening test will only give you an estimated chance. It can't tell you for certain whether your baby has a condition or not. Your results will come back with either a lower chance result or a higher chance result. And if it comes back with a lower chance result, you won't be offered any further testing. But if you are offered a higher chance result, then you can either choose to have no further testing, or you can choose to have the further tests offered to you. One of the further tests is another screening test called non-invasive prenatal testing, which is a blood test that is considered more accurate. And this can help you decide whether you want further diagnostic tests, which include amniocentesis or chronic villus sample. By having a diagnostic test, this will tell you whether your baby has Downs, Edwards or Patau syndrome, but it's important to know that there is a risk of miscarriage when having these tests, but it is very rare. If this is a decision that you do have to make, then the doctor will discuss everything with you before you decide to have these tests. So to prepare for your dating scan, it is useful to know that having a full bladder can actually give you a better image on the scan. So it might be a good idea to have a few glasses of water before your scan, like an hour before. The healthcare professional doing your scan will put a small amount of jelly on your stomach to be able to do the scan, and will use a small probe and put a slight amount of pressure. This shouldn't be painful, but it might be a bit uncomfortable just from the pressure that they put on your stomach. And this will be the first time that you'll be able to see your baby. And after this, the person who's doing the scan will give you images of the scan for you to be able to keep. After your 12-week scan, the next scan will be your mid-trimester scan, also known as an anomaly scan or your 20-week scan. And I'm planning to talk about this in my next video, so please do keep an eye out for this. I really hope I've answered all your questions about the dating scan. If you have any more questions, then please do let me know. I will be more than happy to answer them. But yeah, thank you so much for watching. If you could please subscribe, it really does mean a lot to me, and I'll see you in the next video.